Coming up, Chef Miguel Toro brings us into the kitchen to teach us how to make some of his tastiest, healthy dishes to keep you fit. Then we'll drop into one of the last remaining mom and pop music stores in South Florida to see how they've thrived since 1963. All that and more is today on SoFlo Health. Welcome to Music Arts Enterprises, and welcome to SoFlo Health. I'm Hunter Frankie, and no, I don't know how to play the drums. Thanks, editor. But if you don't have an editor like I do to put in drum sound effects when you're faking when you can play the drums, and you want to learn for yourself and you don't know where to start, then Music Arts Enterprises could be a great place for you to begin. In fact, upstairs is the drum shop where Jerry's waiting for us, and he'll tell you more about the drums and MAE. So follow me. Jerry, good to see you.
Welcome to MAE.
What is MAE?
MAE is your local music store here in Fort Lauderdale. The original owners, which are still the same owners today, the same family, Rosalind and Charles Katz. The current owners right now are Mike and Ken Katz. We've been in business since 1963, at this particular location since 1989.
That's a long time to be in business, especially in the music business. What do you think has kept you guys in business for so long?
It's our personal relationship with the customers, really. The best you'll find in the industry, and we don't compromise when it comes to quality. That's why people come back, and also our prices are the best, guaranteed, nationwide.
I mean, we've got some drums here. Yeah, you're much better at that than I am, but what makes the drum shop so special up here?
We specialize in DW kits, we have cajones, we have everything. Anything that a drummer would come in and see, especially the top end equipment.
And you've got some pretty interesting stuff over here. What's special about this?
This is a djembe. And we have a customer that comes in once a year. His name is Bumba, and he travels from Senegal, Africa, and he brings in these custom-made, all handmade and hand-painted djembes.
That's something that's pretty special as well, that you have something from Senegal in a shop like this.
Right.
Whereas if somebody were to go to a big box music store, they probably don't have anything like that.
They don't have that there, no.
What do you say we continue on with a little bit of a tour here?
Absolutely, let's do it.
All right,
Let's
where are we
show you
heading
guitars.
next? Guitars?
Go to guitars, yeah.
Say less, let's go to the guitars. So this is clearly the guitar shop. Hey, over here. I know there's a lot of great guitars, but we gotta focus here. So this is the guitar shop, yes?
Correct. And speaking of great guitars, I have here is our private stock PRS, marked at $10,000 for this guitar.
So that's a serious guitar.
Correct. But this is not the only one that we have. Yeah. We have a lot of guitars, beginner style, intermediate, and like I said, the private stock. We have all different types of Ibanez, Fender, Squiers.
Whether you're just starting out and you want to try something out, or you already know exactly what you're looking for, you can find what you're looking for.
You find anything here. Everything the musician needs to make their living or just for fun. We have all different types of amplifiers, beginning, intermediate, professional amplifiers, everything from 10 watt to 1,000 watt. MAE is most known for bringing the customers exactly what they need, exactly what they're looking for, and making them happy in the process.
But you tell me that there's actually a whole other part we should check out.
Oh, there's a whole nother warehouse. We got to check it out in the back.
Let's go.
Let's go.
Well, let's not forget the $10,000 guitar. What brought you into MAE today?
Modernizing my old Camco bass drum pedal that I bought many years ago. Originally, the pedal came with a piece of leather, and these fellas here were able to modernize it and to put on a chain.
So you were able to bring it into the modern age.
Incredibly. And this was originally a piece of belt.
And what do you enjoy about coming to MAE?
Just the personal service, the freedom of looking around, and if you want to grab an instrument, you can play it for a few minutes and enjoy and meet some interesting people while you do so.
Jerry, where the heck are we now?
We're in the warehouse of MAE. We have all the equipment that we have out in the normal store, out in the storefront. We also have our rental back line. We have all the equipment to supply a wonderful show.
What do people come to you for the most?
People come to us for equipment, proposals, appraisals, everything.
Yeah, hey, I have this weird guitar that was a family heirloom. What is it worth? Is it worth anything?
Correct.
And then they also say, hey, my son or daughter is getting started playing the drums. What's a good kit?
Exactly.
If people want to learn more about this operation, how can they?
They can go to maemusic.com, that's our website, or they can simply come in.
Stay with us, keep watching SoFlo Health, but first, watch this. Here on SoFlo Health, we have discussed many different forms of weight loss over the years, from basic lifestyle changes to pharmaceutical interventions, and for some people, the best option is surgery. That's why we're here at Mount Sinai Medical Center to meet Dr. Zeta to learn more about it. Follow me. I'm now joined by Dr. Zeta. Doctor, thank you for being with us today.
Thank you for having me.
Of course. We are talking bariatric surgery today. For those that aren't aware, what is it?
Bariatric surgery, in its simplest terms, and this is breaking it down way too simple, is weight loss surgery.
And there are different forms of that. Talk about that for me. What are the different forms?
The two most common ones that I'll talk about are the sleeve gastrectomy, which you've probably heard of as stomach stapling, and the gastric bypass, or the Roux-en-Y gastric bypass.
Okay, and who are these procedures for?
These procedures are designed for people suffering from the disease of morbid obesity.
What sort of lifestyle changes do they need to make?
So the lifestyle changes, which are healthy changes that should be made anyway before surgery, would be following the diet that's recommended, engaging in exercise, healthy exercise activities.
Once somebody has decided that they are ready to have the surgery, what does the process look like?
So the patient comes in for an initial consultation, and we discuss their personal goals and different individual aspects of them that may make one procedure or the other better for them. After our initial encounter, we do a thorough preoperative evaluation. Once the patient completes the preoperative evaluation process, they follow up again in my office for a final consultation, and we plan for the surgery. The surgery is performed here at Mount Sinai Medical Center. Patients generally stay for 2 days and then are discharged to home. Most patients can return to work in 1 to 2 weeks.
What does post-surgery life look like immediately after, and then lifestyle after they've recovered?
So immediately after, the postoperative care is very regimented. We have a protocol of a gradual diet progression that goes over 6 weeks. But the ultimate goal is for patients to return to an essentially normal life afterwards, just with healthy long-term dietary changes.
So are people able to return to activities maybe they haven't done in a long time due to their weight?
Yes, the long-term goal is to not restrict patients, but to improve their life for the better.
And if people would like to learn more from you, where are you located?
I have an office here at Mount Sinai Medical Center, and I also go down to Key West for one of our satellite offices.
So if people would like to learn more, how can they?
They can go on our website. They can schedule an appointment.
Well, doctor, thank you so much for your time. I really appreciate it.
Thank you for having me.
You got it. If you haven't eaten lunch yet, come right back for some inspiration from this Mediterranean spot when SoFlo Health returns. Welcome back to SoFlo Health. I'm Hunter Frankie, and we're still at Music Arts Enterprises. This is the guitar repair shop because they also repair, not just sell guitars. And Ralph's been doing it for 33 years, so let's see what he's up to. What do you do here at MAE?
You see it all around you. People break their guitars, they bring them to me, and I put them back together again.
Officially, you're, I guess, a luthier, as we just learned from our producer, but you say you're just a guitar fixer.
Yeah.
How long have you been fixing guitars?
I've been here for 33 years. I was a couple more places, Ace Music, Miami. And before that, I was the only guy in the band that could fix anything.
How old are you?
I'm 87, 3 days ago.
Oh, happy birthday.
Thank you.
And you're still fixing guitars.
It's all I know.
That's all you know? What do you like about fixing guitars so much?
It's what I do best, and it's what I enjoy most. And then they give me money.
That's a pretty good deal.
Beat it.
So what are you working on right now?
This is an innovation guitar. I didn't say it's a case of fall down, go boom. There's a split right here. So I'm going to go up inside it, bring it back down together again, retune it, and hope it stays there. Otherwise, it's going to wind up on somebody's wall.
Is that the most common case that you see, a case of fall down and go boom?
No, generally speaking, it's just people who want the strings changed. You know, simple maintenance.
Why is it important for people to maintain their guitars well?
Well, it isn't really. Not when I'm here.
That's true. Fort Lauderdale isn't exactly the Mediterranean, but we're getting pretty close. I mean, we've got beautiful weather, people from all over the world. This is the Venice of America, after all. All that's missing is some authentic, delicious, and healthy Mediterranean food. Well, luckily, we have that too with Olive & Sea. Follow me. I'm now joined by Chef Miguel inside of Olive & Sea. Chef, thanks for having us today.
How are you? I'm Mike Force. My pleasure. Great having you, Hunter.
I'm doing great. I'm excited.
Sir.
I'm looking at these ingredients.
Yep.
Fresh, tasty, healthy. I'm excited. What are we making first?
Today we're gonna make our Greek salata, which is one of our signature salads here with us.
Nice. Well, let's get to it. Olives are incorporated into many Mediterranean recipes, and that's a good thing because they have many health benefits. They are an excellent source of oleic acid, which helps regulate LDL and HDL cholesterols. Plus, they're chock full of antioxidants and polyphenols, which help lower inflammation in the body. After putting the rest of the fresh ingredients in the salad, we made the dressing using, you guessed it, olive oil. Are local ingredients important to you here?
It's super important, not only because it's locally sourced, but I'm big in supporting the local farmer, the local community, and you know, why not support those that are servicing around the corner, right?
Yeah.
So I'm big on that for sure.
Excellent.
Here you go. Simple
There it
Greek
is.
salata.
Take a look at that. We'll get set up for the next dish and see you in just a second. So, Chef, what's next?
The next dish is one of my favorite dishes because it's locally sourced. It's a wahoo. So we're gonna be doing a wahoo crudo.
Nice.
This is the beginning of the product. We cure it in some beet juice, and so it has that nice red color on it, and it also adds some nutrient value as well to the dish. All right. So we're gonna start delicately. To finish, we're gonna finish with a herb oil.
Okay.
So we use cilantro, dill, and parsley in this case.
My favorites.
There we go. Wahoo crudo.
Well, I'm excited to get a taste of this at the table. So, Chef, what do you say that they get a look at that, and I'll meet you over at the table?
Fantastic.
Great.
Looking forward to it.
See you over there.
Yes, sir.
My favorite part.
Let's do it.
Let's taste it. Let's talk about it. Try and get a little taste of everything here. Here I go. Oh, yeah.
Very good.
And you mentioned that it is family style.
This is what I love about this type of cuisine, that it brings us back of sharing good moments, sitting down, passing the plate. So
Yeah.
I love it.
Well, I've done 6 years of SoFlo Health, and I haven't had wahoo. So
Okay.
I think it's time.
Let's do it.
Let's do
try
it. Try and get a little bit of everything on it.
Sure.
Here I go.
And I'll do the same
My
thing.
first wahoo experience. Wow. I'll tell you what, I've been missing out.
Very good, right?
Very good.
Wow.
Packed full of flavor. And not to mention something that we haven't even talked about so far, the gorgeous views that you have right out here.
Right.
Yep, and it's just another place that I can tell the people of South Florida that eating healthy doesn't have to be lame.
Exactly.
This is delicious, it's healthy, you can share it with your friends. Thank you so very much.
My pleasure.
I've got more to eat. We're at Baptist Health Miami Neuroscience Institute. Today I'm joined by Dr. Wicks. Doctor, thank you for being with us.
Thank you.
Of course. And we were talking about something that's a pretty serious subject today, which is aneurysms. So let's start with, what is an aneurysm?
So brain aneurysm, and that's what we're primarily focused on, is basically a weakness or an outpouching in a blood vessel within the brain. And the concern is, you know, could this weakness or outpouching break open, causing bleeding in the brain, which can be quite severe. And so when that occurs, you know, approximately 1/2 of patients, you know, don't survive to make it to the hospital. And then many patients go on to have, you know, severe neurologic deficits or weaknesses. And so we want to try to prevent that.
How would somebody know if they have had an aneurysm or are prone to them?
Usually they don't cause symptoms, and usually they don't necessarily cause chronic headaches.
When it comes to recovery, What does that process look like?
In general, when the aneurysm is not ruptured, the recovery is usually quite good after treatments. And so it's really just kind of the immediate post-surgery or post-endovascular treatment recovery of a few days. You know, with surgery, it takes a little bit longer,
Sure.
for about a month or two. But you know, that recovery is quite good. In terms of when you have a ruptured aneurysm, and patients who come into the hospital doing well tend to do well in the long term with recovery.
If people would like to learn more, how can they?
Definitely contact us online at the website below for the Miami Neuroscience Institute, or give us a call at the number and we can, you know, arrange a follow-up appointment and discuss all of this in detail.
Great, thank you so much.
You're welcome.
More from MAE and acupuncture pain relief is after the break on SoFlo Health. Welcome back to SoFlo Health. I'm Hunter Franke, and if you're just joining us, we're at Music Arts Enterprises, where we have seen the drum shop, the guitar shop. They've got keyboards, and they even do build-outs for concerts and installations for venues, and they've got the top-of-the-line gear. As you can see, this keyboard here, with the price tag of $10,000, clearly only the best.
I was having pain in my hands and just being exhausted, so I just wanted to see what was the program, eating right and seeing what was going to happen with that. So I had the summer off, so I figured let me try it without acupuncture. I had a very bad experience a couple of years ago. I believe in Eastern, Western medicine. However, I was not going to do acupuncture.
And what's changed since then?
I am addicted to acupuncture. I was having hand surgery, reconstruction of my thumbs, and what had happened was I was scheduled for another surgery, and 3 weeks into acupuncture, I can move my hands without pain. Like, honestly, this is a true story.
That was Nina you just heard from. This is Dr. Monique of 5 Element Wellness Center, where we are today. Tell us about Nina's journey.
She came in for a consultation for the weight loss, then decided to just try. She told us that she had a bad experience in the past. We kind of convinced her to just try it one time, and then after that one time, she said she was completely hooked.
Yes, and she said that she had surgery in the past, she was scheduled for more surgery, and she was experiencing a lot of pain until acupuncture. A lot of people at home might listen and say, is that really possible? What would you say to that?
Absolutely, absolutely. We treat all kinds of chronic pain. We can treat inflammation, but it's not just the acupuncture. It's the whole treatment plan that we put together for the patients. Diet has a lot to do with inflammation as well, not only with the weight loss aspect, but also with the pain aspect. A lot of people are drinking and eating things that they don't know that it's just making their pain worse.
So you could be experiencing pain at a higher level. It can be exacerbated by your lifestyle.
Oh, yes. Yes, absolutely. Nutrition being a big portion. There's supplementation. We help them with herbs as well, which is the Oriental medicine portion of it. And then the injections. She's actually doing lipotropic injections to help with the energy level and just to metabolize the fats a little bit faster. She's using red light therapy.
And who is this program good for?
Anyone that wants to lose weight or that has any kind of chronic pain, anxiety, stress. If you're breathing, it's good for you.
Excellent. How can people find out more if they'd like to?
They can come into our website. They can call the office. They can actually come in one of our seminars. August 2nd is going to be our next one.
Great. Thanks so much.
Thank you.
Of course. Thanks to you too, Nina. Remember Ralph from earlier? Well, there he is in 1998 working on guitars all the way back then. Let's hear more from Ralph. What's the #1 piece of advice you could give to people to take good care of their guitars?
Enjoy what you do. You know, the more you enjoy what you're doing, the more likely you are to take care of it and propagate.
Is there anything special that you do to make sure that everything's great with the guitar?
Yeah, well, there's certain things that I attend to, like I don't want to have the strings too high because it makes difficult for the player to finger the notes and have to press too hard. So I It's called lowering the action, the action nice and low. Also, I make sure the tuners are working correctly, and just little things that need attending to. Whether cord goes in here, that's called a jack, and sometimes it gets corroded because we're up near the ocean, damp atmosphere, so I cleaned that out. Stuff like that. This little, just stuff that needs doing, like you do with a car, only much less expensive.
Is there anything else you'd like us to know about working here at MAE or fixing guitars?
It's a very nice place. It's also 5 minutes from where I live.
I was talking to Jerry, and he said you guys have had lots of famous people, throughout the years come through here, rent equipment, stuff like that. Have you worked on any particular famous guitar or artist's guitar?
I did some stuff for the Bee Gees, but that was quite a long time ago, and I wasn't here then. I was someplace else.
We won't tell anybody. What'd you do for the Bee Gees?
Just taking care of the guitars, fixing them.
Well, thanks a lot, Ralph, for sharing your story a little bit. We'll let you get back to work here.
Thank you.
And thanks for letting us in your dojo here.
Oh, free anytime, Bring a champagne.
Will do.
Okay.
Thank you, sir.
My pleasure.
Welcome back to SoFlo Health. I'm Hunter Frankie, and we are wrapping up our time at Music Arts Enterprises. This is the acoustic room, and it is climate controlled, humidity controlled, because they want to take extra care of all of these beautiful acoustic guitars that I'm sure are quite expensive. We have seen a lot here today and showed you a lot here today at Music Arts Enterprises, but guess what? It's barely even a quarter-ish of what's actually here. It's just one of those places you have to see for yourself. But that's all we have for this week's episode of SoFlo Health, so let's see what's on the next SoFlo Health. After 6 years of SoFlo Health, I finally show you my actual workout. Join me for a full leg day in the gym and billiard tips from a professional at a local smoke-free pool hall. As always, you can watch previous episodes of SoFlo Health using SoFloShows.com. And you can also share with us what you're doing to stay healthy using @SoFlo Health. Until next week, it's goodbye and good health.